Hi, everybody. My name is Fariza Kershad, and I'm the chapter lead for Data for Good in Edmonton, as well as the manager for analytics at Alberta Blue Cross. I'm here today to talk a little bit about health data on a mission from the Data for Good perspective. So who are we and what do we do? Data for Good is a not-for-profit, and we're modeled after DataKind from the US and the UK. The reason we don't use the word DataKind is because it's trademarked. So instead, we went with a slightly different title called Data for Good. We're a federal organization. We have several chapters across the country. Alberta's in a semi-unique position in that we have multiple chapters in the province. We have Edmonton and Calgary chapters that have been around for quite a while. Ontario also has several chapters, but they haven't been around for as long. Edmonton and Calgary also work very closely together typically. Our entire focus is supporting not-for-profits within Canada with data, AI, and machine learning projects. So some of the not-for-profits that we've worked for historically include the Edmonton Community Foundation in 2017. In 2017, we had a datathon with the Edmonton Community Foundation looking at the successful attributes of grant applicants, as well as the characteristics of unsuccessful grant applications. We did something very similar in 2018 with the Alberta Foundation for the Arts. In addition to looking at successful grant applications, we also had a couple of different questions that we were exploring. One of them was where was funding coming from, and where was funding going to? In terms of where funding was going to, we were actually quite interested in it from a spatial perspective. Was funding going to where artists live, where people are attending events? And so we were looking for correlations with that. One of the biggest findings from that datathon actually turned out to be that we didn't have the data we needed to answer the questions that were being asked by the Alberta Foundation for the Arts. So the biggest feedback for them was that they needed to start collecting different data points if they wanted to be able to answer the business questions that they had. And so that alone was a big factor, was a big help to them, because it allowed them to sort of realize that if they wanted to be doing data analysis, they needed to start at the front end and look at what data they were collecting. Most recently, in 2019 and ongoing, we've been working with Homeward Trust in Edmonton. I'll go into the projects that we've been working with Homeward Trust a little bit more in detail. In 2020, we worked with the Nature Conservancy of Canada. That is an organization that I believe is based out of, it's headed out of Alberta as well. The one cool thing about the 2020 Datathon was since COVID happened and since everybody had to go digital, we were able to hold that Datathon across the country. So 2020 was the first national Datathon for Data for Good in Canada. So before we get into a little bit more detail, I wanted to just highlight one terminology weirdness, I guess. So we have not-for-profits and we have charities in Alberta. A not-for-profit is a provincial designation and a charity is a federal designation. So they are regulated differently and they are managed differently and they have different meanings. Typically, colloquially, we tend to use the terms interchangeably, but it is worth noting that groups such as Alberta Health Services and Alberta Blue Cross are actually not-for-profits. So a big part of our healthcare system is actually entirely through the not-for-profits. However, when we talk about not-for-profits day-to-day, that's usually not what we're thinking about. So I'm talking about it more in the colloquial sense, where we're talking about organizations like Homeward Trust and the Alberta Foundation for the Arts. I'm not talking about organizations such as Alberta Health Services and Alberta Blue Cross. So for an organization for Data for Good, how do we get access to health data? Health data is personally identifiable information. So the reality is it's incredibly hard to get access to this type of information. I used to work for the government, and even within the government, it was incredibly hard to get access to this data. It is under lock and key, and for good reason. It is incredibly informative information. It's valuable information. So what do we do instead? We work with open data instead, primarily. And so there's actually quite a few amazing resources for health open data. So I've been in the healthcare and analytical space for almost 2 decades now. And when I started off, a lot of these data sets were data sets that required a full legal agreement. I would get them mailed to me on a CD. Not only that, when I got the data, I could only share it with like 2 other people in the organization. Those were some of the common restrictions that were around these data sets. Today, those restrictions no longer exist. If I want access to the National Health Expenditure dataset, I can go straight to the website, download that data, and have access to it immediately. So the National Health Expenditure dataset is a really great health open data. It contains data on health expenditures that allow you to compare and answer many public policy questions. Other common data sources that we use are the StatsCan public use microfiles. So an example for that would be the Canadian Community Health Survey. The Canadian Community Health Survey is run every couple of years on Canadians, and that data is now available. The StatsCan has actually been really phenomenal in the last couple of years. So the T1FF family file and the census data are now available for anybody to use, but they're also available via APIs now. So that means Python and R allow me direct access to that type of data. 2 lines of code, and I've got access to the census data, and I've got access to the T1FF family file. And that allows us to drive some really interesting analysis. So an example of an analysis that we've used this type of data for was actually at the ATB Datathon, I believe in 2018. In 2018, ATB had a datathon that was looking at what were some of the drivers for mental health in the province. And so we defined the problem that we wanted to solve as what areas of the province are more at risk for mental health. So we were able to grab the mental health emergency data from Alberta Health, the interactive health data application, and we linked that to the census data. And then we were able to look at demographic factors that might have driven those emergency visits. So we were looking at factors. And the driving factors were things that you would naturally expect that were common sense. But what it did allow us to do was to develop profiles for the province and say, you know, these are some of the areas that are more at risk. These are some of the areas that are not at risk. And then that would allow you to make sure that your service delivery was aligned. It was, like I said, the results from that were fairly common sense. And some of the driving factors were things like high rates of unemployment, high rates of single parents in the area, high rates of low education. And so those were common drivers that we found in that particular source. I will just make one last comment for the slide with the health open data. Several of these are at a federal level, but the interactive health data application and the community profiles are only Alberta. And those types of data sets are actually fairly unique, and that we've got access to those is pretty cool. So one example that we've worked on for the last 2 years directly with Homeward Trust has been looking at the Housing First program and the success of participants enrolled in the Housing First program. So in that project, we were looking directly to say, can we predict if someone is going to be successful in the Housing First program, or are they going to be unsuccessful? The data that we had access to was individual row-level information. So Homeward Trust gave us a lot of that data. But because of that, we had to actually sign agreements. So we signed legal agreements with both the province and with Homeward access to that data, and we had to keep it really secure. So that project actually was a small team, and it was really cool. And we had a couple of people working the last 2 years. That is not directly health related, though. So some preliminary results from our Housing First project was from research. We know that Housing First works about 75 to 95% of the time. So what about the other 10 to 25%? So we used the caseworker notes, we used individual level data. The caseworker notes were they did help improve the model significantly. So what we found was we could get a 77% accuracy rate using machine learning algorithms with some natural language processing as well. We did try traditional statistical models. These are only preliminary results at this point in time, though, and we are working on getting a peer-reviewed paper published in a journal within this year. So what are some other use cases that are more related to healthcare from an international level? So these are projects that DataKind has been involved with, but not necessarily Data for Good. So these are examples of very specific healthcare analytics. So one would be a project that was done in the UK that was looking at something very similar to what we did with the Arts Foundation, except they were looking at it from a hospice perspective. For children's hospices, are they being put in places where the kids actually are? Are they in the areas of the highest need? And what they ended up finding was it was fairly well structured, but they did find that, you know, there were some areas that were underserviced, and they found areas that they felt that even though they were providing services, they were under-resourced. Another example is from NextLeaf Analytics, and they were working with a project in Kenya where they were using sensors to monitor refrigeration there. And so the refrigerators are used to store vaccines. And if the refrigeration goes down, then your vaccines are destroyed. So NextLeaf was deploying sensors there to monitor these fridges. This one was a really interesting project because what they ended up finding here was that if you're plugging in your sensors and your refrigeration equipment to the same outlets, when you lose power to your sensors as well. But since the sensors were were built into smartphones, they actually had a battery backup. So they were able to actually use the data from the phones themselves as part of the model, because the battery levels in the phones were actually quite indicative of what was going on in that refrigerator, much less just using the sensor data. So that was kind of a cool project from that perspective. Another one that I found quite interesting was DC government. And so this was at a hackathon that happened a couple of years ago. And they did solve a very specific problem, but they also generated a tool that could be used. So what they did there was they were looking at developing a social services reusability tool, eligibility tool. And they made it into a reusable model so that somebody could come in, change the configuration file and say, you know, these are the services we have, these are the criteria, and these are the questions we want to ask. And so as long as you put it into their framework, you should be okay to have this tool just rolled out. And so building frameworks like that, I find really cool and a really great opportunity, because something like that can scale much farther than a single analysis. So what are our next steps locally as we continue to work in this space? So the next steps that we're working on locally are setting up a secure server. So as we start working with more of this secure data, which we've done with Homer Trust and Nature Conservatory of Canada, we found that we've had to sign legal agreements. So because of that, we're working on setting up secure servers. The other thing that we're working on are just expanding our partnerships this year. So we're hoping to work with IFSA, continuing our work with Homer Trust, and working with the Edmonton Public Library. If you're interested in getting involved, you can join Data for Good at YEG at themeetup.com, or you can contact me at Fariza Kershad at dataforgood.ca. So thank you for listening, and I'm going to pass it over to Sinji to talk a little bit more about data on a mission. Thank you.
Thank you, Fariza. My name is Shinji, and I'm the Chief Analytics Officer for PolicyWise for Children and Families. So Fariza spoke to projects that utilized advanced analytics on large data sets to provide incredible insights, especially for housing and homelessness. I'm going to change gear a little bit to turn into some basics and talk about a couple of initiatives we did related to non-for-profit organizations and the data capacity of the sector. Then I'll tell you a little bit about our observations around that and how the tech sector especially can help with building capacity. Just a few words about PolicyWise. PolicyWise for Children and Families. We have a mission to improve the health and the well-being of children and families, and through research, evaluation, and data analytics. Now, a few words about the social determinants of health. This is likely a familiar concept, and we all know that health is not simply a healthcare issue. The health of an individual, as well as the health of a population, are impacted, influenced, or determined by many factors, such as the environmental factor, the economic situation you are in. Poverty is well known as the factor that are highly associated with poor health outcomes. When it comes to environment, it could be family environment, the family dynamic, the parenting style, or sibling rivalry. What about neighborhood environment? Does the neighborhood have cohesion? Do you feel a sense of belonging? And what about stores and gardens, schools in your neighborhood? We probably all have heard the study about how fast food restaurants and fresh markets in the neighborhood can influence health and healthy choices. And of course, there are many other factors like education, social services, and support. From a client-centered model or patient-centered care model perspective, services provided to individuals need to based on their needs, all of their needs. So their needs are at the center of the care, not the administrative divide of sectors, whether it's health, education, or social services. And in this kind of thinking, data is vitally important to support or facilitate the coordination. Now, I'm going to talk about a project we did with C5 in Edmonton on data integration. So the original objective of this project was to see whether there are common clients among these 5 different organizations and how the referral pattern would look like. These are organizations who provide multiple types of services, social, employment, and mental health in the northeast region of the city. When we linked the data, what we noticed was the data quality was a huge issue. And the data they have collected would not answer fully the questions they had, although the initial analysis had indicated some ways forward. But a lot more work needs to be done. Another initiative that we're involved in and have been leading in the last couple of years is the Alberta Nonprofit Data Strategy. We work closely with Alberta Nonprofit Network, ABNN, on this project. Back in 2015 and 16, there were broad community engagement activities around data capacity and data needs. That's led by Jeff Kazakib and the Calgary Chamber of Voluntary Organizations, or CCVO. A data strategy roadmap was developed by Jeff and CCVO in 2019, which really helped the sector to be clear on the way forward. Since 2018-19, we have been working closely with ABNN to lead some of the planning and implementation of the strategies. That's identified in earlier work and continued engagement of the community. The focus of the work mostly around building capacity, developing resources, improve skills, and develop standards, and improve data quality. And this year, we also looked at data about the sector, in which we're going to answer questions like what's the role of the non-for-profit sector in Alberta, and how the sector contributes economically to Alberta's economy, and what about value and impact, what about workforce. So it is through working on these type of projects that we learn about the sector and about the community agencies. There are a lot of registered nonprofit organizations. Farisa just differentiated the non-for-profit and registered charity. There are lots of them, and they vary greatly in size, and they almost always provide multiple types of services, especially in the social service subsector. They have multiple funders, and they tend to work together through coordinated services to serve the most vulnerable population, and often they have complex needs. And they are, their capacity and resources is very limited as well. Now, in terms of data capacity needs, they will need a lot of technical and data infrastructure, whether it's hardware, software, data architecture design. We don't have a lot of people in the sector with technical skills, and seldom organizations would have data strategy. They haven't gone through the strategic thinking on why they collect data, what data, and how they actually use that data. They also need data standards, and because their programs are funded by different funders, and they may have started these programs at different times, within an organization, it could be there could be multiple data systems, and ranging from paper files, Excel spreadsheet, to comprehensive case management systems. So there is a strong desire for integration, and sometimes they do embark on a common intake process. And they also need support in analyze and using the data. Data sharing capacity is also very limited. Now, what can we do to help the sector with this kind of needs? I think there might be business opportunities here. First is simpler and cheaper case management tools. I know there are a lot of big players out there in this space, and there's large and comprehensive case management tools. But there's a real gap for organizations who actually can have an easy to use and cheap to maintain kind of case management tool. Another piece that really needed is the tech tools need to be evaluated so that the organizations can easily pick and choose the tools that's relevant to them. And the evaluator needs to be a neutral third party. And thirdly, what the sector also need is data sharing platforms, whether it is for booking and referral or for client to choose and book on, so that, or a large platform so that the all the services on it and clients can choose, book, communicate, and share their information with their service providers. So clients don't have to tell their stories multiple times, and they also don't fall through the cracks due to lack of tracking on follow-ups and outcomes. So I'm going to stop there so that we can leave a few minutes for questions for Fariza and myself. Thank you. Fariza? We're still waiting for questions to come in. Oh, here I see Fariza.
Yeah, sorry, I was having technical difficulties. It looks like we have a question. When you're using open data, how do you include standard determinants of health in the analysis? So for that one, do you want to take that, Cynthia, or should I?
You go ahead.
All right. So looking for the standard determinants of health when using open data, usually at that level, we have to aggregate everything to the same spatial level or the same time period level. So what we'll do is try and use aggregate data. And for the social determinants of health there, we try and link it up as much as we can with the census data that has data on some of those social determinants of health. So it'll have aggregate data for the area that includes things like what level of homelessness, what's the level of income, sometimes even food accessibility, depending on what data sources you're using. So bringing in the social determinants of health is somewhat easy at an aggregate level. It's actually much, much harder to do that at an individual level when you're working with individual level data. But at an aggregate level, it's actually quite straightforward.
Thank you, Fariza. I agree what Fariza just said. So at individual level, linking data across different sectors is very, very challenging. And the question was about open data. Obviously, with open data, you really don't see individual level data. But when you do have aggregate data, especially when you can overlay the data by geography, sometimes it does give us some indication of aggregation on certain types of risk factors that can help us to understand the issue a bit better. Fariza, I don't see any other questions.
There's a comment or a question just came up. Yeah. EHS consultants are often leveraged to assess safety management data systems and tools. There is potential to set up the same framework for social management tools. That's interesting. Is EHS Employment and Health Safety? I'm not familiar with that acronym. Emergency Health Services, maybe? Do you know what that one is? Nope. Okay. No, that's a
no. I'm not sure what it is.
Not a field I'm familiar with, so thank you to whoever put that in there. Something that we can definitely take a look in as sort of we work through these spaces and frameworks.
Yeah, if the person who made the comment would like to connect with us, we'll be happy to have a further conversation to see how you actually can help the sector, to build tools that with features, you talked about for sure. Yeah.
All right, there's another question. Is there any appetite to collaborate across organizations for technical and data solutions? The answer to that is yes. Sinji, do you want to talk a little bit about that network that you're talking about that would link some of that information?
Yeah. Absolutely. The desire and appetite for coordination and working together in the sector is huge. So that's just the nature of the sector. That's how I feel. Absolutely. And the truth is, there are pockets of activities already happening. So organizations getting together to share data, to build systems so that they can work together better. So for sure, absolutely.
I'll just add on to that a little bit in terms of collaboration across organizations for technical and data solutions. Some IT organizations have been super supportive, willing to donate software and stuff like that. One of the really cool initiatives that I've seen lately has actually been out of TD Bank. So TD Bank had set up an analytical support so that not-for-profits could go to their data scientists and they would get support from their data scientists directly as part of their team. And I thought that was kind of a cool initiative from industry that sort of not just volunteering money back, but volunteering the time and services of employees who are skilled back to the community. And I thought that was sort of a really interesting initiative when I've heard of it. So there's another question here. How difficult is it for social service organizations to collect social determinant of health data at an individual level? And do you use standard screening tools like PRAPARE? Okay, so I will tackle
I guess.
This. Yeah, prepare, but no E.
Yeah.
So they actually do collect a decent amount of social determinants of health, but some of them are fairly hard to collect from certain individuals, and they don't always collect all of them. There has been a push towards, collecting. We can, according for the all the privacy acts, you should only collect the data that you need to deliver services. So there's always a hesitancy to collect more information that you don't need necessarily to actually deliver those services. The second part of this is, do they use standard screening tools? Yes, they do. The problem is, to some degree, though, that not all agencies use the same screening tool. Not all agencies collect the same information. So as you start trying to work across the different agencies, you'll find that there's different systems set up. And that's actually the project that we're looking at a little bit with IFSA, is the what's the standard screening tool to actually set up and implement for them. And so that's the project that we're looking at with them there.
Mm-hmm. Definitely. In terms of standard screening tools, each of the subsector, they work very hard to standardize that so that they can have screening tools for, say, immigrants, for mental health or homelessness, right? So there are screening tools, but not necessarily centered around health per se. So depend on what the issue is. And that when they collect that data, and they actually can compare across. So that's always very helpful.
Last question for you, Sinji. When you say Amazon for social service, are you thinking of a marketplace?
That's just an analogy. So what I'm talking about is that a platform where service providers could be on there and service users can be there as well, so that they actually can book their services there. They actually can share information if a client chooses to do so with the providers who give this client services, to say, I would like you to share my health information with Homeward Trust, with, Bissell, whomever, because I'm actually receiving services from them. So the referral can be handled and managed through that platform as well. So in that sense, that the client would have control. So I'm not sure marketplace is the right term in there, but what I'm really looking for is a platform where the services and clients can connect.
Somebody clarified that EHS is environmental health and safety, so thank you for that, Jean. We appreciate that comment. Actually, that is definitely worth us knowing. So I think that is all the questions and all the time that we had right now, except how can you guys connect with us? So again, Data for Good is on meetup.com. We have chapters for Edmonton and or Calgary. You can send us an email through there, and that will connect you directly with one of us.
And the PolicyWise email is on my slide. I'm sure the slides will be shared, and so you can find our emails there. Thank you.
Thank you for listening. And we should be done.